morning. And here we are again. Can I just check that you can all hear me? Perfect. Thank you so much. It is fantastic to welcome you all here to this absolutely beautiful venue. And it almost seemed a shame to get you all to come in because the chat out there was deafening, absolutely deafening. But we do need to make a start. We've got a really exciting programme ahead of us today. I've got a few things I need to say, first of all. I think just this is where we are. This is what we're doing. This is the conference, and it's 2026, just in case anybody was wondering. My first thing I think I want to sort of let everybody know about is I think most people are aware of this, but we're in 2026, and originally we had thought that March 27, that would be the end of this quinquennium of the school. That's not the case. The excellent news is that we have got an extension through to 2029. So we have got 2 years of additional funding. We've got new funding. We'll be able to do new research. We'll be able to do new capacity building. And we're busy working with all of that now. This is a quote from Lucy Chappell. I'm not going to read it out, but this is what has been announced in terms of what might be coming down the track. As yet, that's uncertain, and this is the quote here. If you can see that this is about the 3 schools, so we are one of 3. There's a school for primary care research and a school for social care research too, and all 3 of them now are funded through till March 2029. So there's a bit of a rethink going on. We've been asked to be part of that, and you can absolutely rest assured, although this talks about working with the 3 directors, from the point of view of the School for Public Health Research, I will be engaging people across the school in that process. So I think just rest assured that I will be letting you know what's going on and getting people to get engaged in that process and make sure that we're securing public health research, prevention public health research for the future. Now, tomorrow morning, we have Lucy Chappell with us. Okay, she's here to speak. She's only staying for her presentation, and she has said that we'll do Q&A. I'm chairing, we'll do Q&A. So please get your questions ready for Lucy, and hopefully we'll have an opportunity to talk with her. She's not staying any longer than her presentation, so that's your chance. Okay, so this is what we're doing. I want you to watch out for our celebrating success. In between presentations and in the breaks and so forth, there'll be a rolling set of slides to celebrate some of the things that we have done over the last year. So look out for this in the breaks. If you're looking at it and going, oh, I did something wonderful and I'm not there, well, you didn't tell us, okay? So if you did something wonderful and you're not there, tell us and we'll try and add something for tomorrow. But we'll definitely celebrate it, okay? We can only celebrate things we know about. Please email that address if you want to add something. The programme for today is here, and again, I'm not going to go through it, and that is tomorrow. If you flip, if you've not noticed yet, flip your name badge. It's the right way up, and you've got a quick reminder of the programme and the time, so there's no excuse for not knowing what time you need to be back and have coffee, etc. There is a QR code somewhere. I think it might be on the next. Let's have a look. There it is. So there's a QR code where you can download the full programme. Okay, but on the back of your programme, you've got the you've got a quick guide. We're through to 5:30 today. We have a keynote at the end of the day, and then tomorrow we start at 9 o'clock. And please be here promptly. I'll remind you at the end of the day. Tomorrow is Mental Health Awareness Day, and if you have brought anything green, please wear it. Okay, wear green tomorrow. So if you've brought anything green, please wear it tomorrow. Even if it's a hair slide, Matt, I know you'll have a whole set of hair slides. Okay, so if we need any extra, Matt will have some. So this is the QR code for the programme. If you'd like to download that. A couple of housekeeping. Fire exits and alarms. The exits are there and there, and I think there's one up at the back there too. As far as I'm aware, there's no fire alarm test planned, so please do make your way out of there, and our colleagues from Beacon House and also from the venue will guide you. We've got the toilets I hope you found. Next to there, which are just past the bar, through the little doorway near to the bar area, sort of to the other side of it, to the toilets, there is a cloakroom. So if you've not found that and you're carrying your coats and bags and would like to get rid of them, there's a cloakroom there that you can leave your coats and bags. The posters, and please do encourage you to view those posters. You've got an idea of where the room is. A lot of people have put a lot of work into the posters, so in the breaks, please do spend some time actually looking at those and talking to the people who have brought those posters. Wi-Fi, I think, have people found the Wi-Fi? It's not on here. Do we have somewhere that we can direct people to Wi-Fi who haven't found it yet?
It's the public open network.
It's a public open network. Okay, so hopefully you've all found that. Thank you. I'd forgotten to check that one. And we'd like to welcome Bhagesh again. You may recognise him from Bristol, and we're really pleased to have you back with us, so welcome. And Bhagesh will be taking some photographs throughout the next 2 days. If you don't want to be in a photograph, you should have been asked at the desk, but please just let Bhagesh know and he'll make sure that that's addressed for you. Okay, so Mental Health Awareness Week. That's what we're looking to do. There's no organised walks or runs this year, but please take time to read or walk and do another positive action and look after yourselves over the next couple of days, and always, of course, not just the next couple of days. There is an allocated space in the Dickens room. If you want a quiet space, we always have one at the meeting. There's also green spaces around Bloomsbury and behind King's Cross. For those of us who lived in London in the 80s and 90s, to say there's green space behind King's Cross sounds really weird. It's not something somewhere you would have gone. It's nice that there's now green space behind King's Cross. Okay. So the next thing is just to remind you that we're having a sustainable ASM. As always, we're making it as sustainable as possible, working with our wonderful colleagues at Beacon House. Our meals will be plant and vegetarian based, so hopefully something for everybody. We've done minimal printing, which is why you don't have programmes and you have the QR code. And we will be doing a carbon footprint report from the meeting, which we always do, which is why you were asked about your travel here today. And we strive to make that less each year. Okay, so a few reminders. So, for those who are able, when we do clap, please stand, and just means that you get an opportunity to stretch, and also everybody loves a standing ovation. So, please, if you can, it just means that you're breaking up your sitting a little bit. So if you're able, if you don't feel obliged, if you prefer to stay sitting, but that is what you're able to do. There is the Dickens room I've already mentioned, and then there's also a prayer room and private space in the Bronte room A. So please don't use that for meetings. There is a Bronte room B, which is available if anybody does need to do a meeting during the conference. Why would you have done that? You'll miss out. But if you really have to, please use Bronte room B. Okay, getting the most out of ASM, please take time to interact and network with each other. That sounds crazy after I heard the noise out there, but there we go. The posters are in the Chaucer room, so again, go and have a look at those. Visit the stands. We've got our PAN, our Public Advice Network with us. We've got the RSS Specialist Centre for Public Health Research, and we've got the School for Public Health Research stand out there, of course. So please do go and visit them. Join the conversation. We've got the hashtag there for our LinkedIn. And if you're not on our LinkedIn, please join. We had a very large number on Twitter for the school, and we're no longer on Twitter. We're not using Twitter. So please do join the LinkedIn if you're not, or if you haven't already. And don't forget to give us your feedback. There's some feedback boards there. And last year, if you remember, there was motivation. The motivation this year is altruism, okay? And to help us to plan for next year, of course, because we will be having that. The other exciting news, before I do that, I want to thank Imperial and London School of Hygiene and Tropical Medicine colleagues for chairing our scientific programme for this conference, and also for helping us to host. So Matt, Esther and Anthony will be chairing some of their sessions and so forth, and having other duties throughout today. But their main work is done. So thank you all, and they're all with us today. This is the exciting news. So NIHR has got new branding. I know you all came here to hear about this, didn't you? So it's coming soon. We're not using it. We're not using it in this conference. We already had our slides, our templates and everything else. Amy Johnson, our comms manager, will be guiding you after the conference and during the rest of the next few months to implement the new branding all together. It is very clear that we are not to use a mix. Okay, if you use a mix of last year, of the old branding and the new, because obviously it's very different, there'll be a bolt of lightning. Okay, so you mustn't mix them. We have to use the new ones. Now you see the has anybody spotted the difference in the NIHR? Okay, well there's a top and the bottom to the I. Okay, so this is our new School for Public Health Research logo. Let's see if there's the old one. There's the new one. This is our new branding. There'll be new colours and new whatever those things are called, the little gizmo, little doobries that we put on things, and we have asked, and we will be working with NIHR Comms to create some of those little icons that are slightly more appropriate to public health and to social care. There are a lot of them that are really very clinical. And we've made that point, and they've said we can help them to create some that are less clinical that we will be able to use. So Amy and Michelle Wilson-Chalmers and Amy Johnson will be working to help roll all of this out, and you'll be getting new templates and so forth. So yeah, exciting. And then I think that just remains for me to say, enjoy the conference. It's 2 days when in the programme for the year we get together and listen to what everybody else has been doing all through the year, and it's just such a great opportunity for us to be able to do that. So if this is your first ASM, welcome. I think you'll find that everybody's very friendly, and that people really do genuinely want to hear about your research and what you have been doing, and this is an opportunity for us to really celebrate that and then just enjoy being together as the school. So it is a highlight. There's a lot of work in preparation to get to this event, so now we're here to enjoy it. So thank you. I think now my next job is to introduce our first set of speakers. So I'm going to put my glasses on. So we have our lightning talks. Now, you know, in the past, the feedback that we've had about this meeting is you enjoy all being together and not having breakouts. So there's no breakouts. And also the other thing that you've really enjoyed are the lightning talks. So what we're going to do is I'm going to introduce Bennett, Thomas Davies and Lucy Anderson. And I'm going to ask you all to come up onto the stage now, please. Okay, so what we're going to do here is we're going to have the presentations one after another, and then we'll have Q&A afterwards. Okay, so first up is Jax. Welcome. I'll leave you the pointer, Jax. You might need that.
Thank you. My stopwatch has just done really strange things, so I'll probably get bubbled. There you go. Morning. Up first, I'm Dr. Jax Bennett. I'm at the University of Bristol, and the idea of these lightning talks is to give you a sort of snapshot of our fellowships, the sort of highs and lows, rather than a deep dive. So that's what I'm going to do over the next couple of minutes. That's what I'm going to try and do. 2 years ago, I gave a lightning talk here, and I presented a big idea at the beginning of my launching fellowship. I wanted to take higher education data, of which we have a lot, student data, amplify it and use it to improve public health outcomes for students themselves and for young adults more widely. So that was how I envisaged having public health impact. How did I do it? Well, this thing is really slow. I jumped over lots of hurdles, particularly last year. This is where the bulk of the work was. I jumped loads of hurdles and I put lots of pieces of the puzzle together, and that was basically pulling in VCs, pulling in universities, pulling in students, talking to them about how we could use personal data and mental health data to actually look at where we might intervene in young adults' education journeys and improve things for them as they went out into the working world. It was a lot of work to pull those networks together. I actually managed to get access to my own institution's mental health data, and we've been working on that in the background, looking at where we might improve things for young people. And we pulled together this enormous bid, and we went to the Wellcome Trust just before Christmas, and we asked for the money, and they said, no, not this time. We got great feedback, and they said, go again, come again, great idea. And I said, I'm on a short-term contract, much like many people in this room. Time is running out, what do I do next? Well, bizarrely in this fellowship, a job came up 2 weeks later. In my old department at University of Bristol, we're developing a new master's in mental health science. I went for the job, I got it, I've started. I'm going to be supporting the new generation of public health researchers on their journeys. I also get to continue to work on my own data, so we improve things at institution level, and I also get to work with my colleagues on building the next grant, the next bid, with that brilliant project that we put together as part of this fellowship. So what would I say? Did it go to plan, impact-wise? No, it didn't. Could I have done this without SPHR? No, I couldn't. Hopefully there's some impact there in a very different way, teaching, institution-level research and going back and doing the grant again. It's an up and down journey, and I could not have done this without this fellowship, so thank you.
That wasn't what I was expecting. This is different. Okay, that's me. Okay, right. Start out confused, this is good. Okay, so public health interventions are often made up of several, if not many, different components. To illustrate, we can envisage a simple scheme of 4 different physical activity interventions that vary in the number or type of components that are implemented. A school-based physical activity intervention, for example, might only include physical fitness activities. It might include that alongside teaching, or alongside elements targeted at mental processes, or maybe all 3 of these combined. But should we expect all of these to be as effective as each other? Systematic reviewers will seek to evaluate all the evidence available on a particular topic. But often when it comes to quantitative analyses, reviewers might fall back on kind of more simple pairwise approaches that lump all of that evidence together from different interventions into one pot. And that can obscure the variation that might exist within that. So we can ask, is there more that we can learn by investigating the complexity of public health interventions further, looking at a component level? Methods such as component network meta-analysis might be able to help us. And my PhD is focused on how this method, really a group of kind of related methods, might best be used by systematic reviewers for public health questions. Now, I would love to tell you that this is all very straightforward and that there's one simple path where you take your evidence for any particular public health topic, apply the method, and it will give you all the answers, everything you really didn't know you wanted to know about intervention components. Unfortunately, the reality is a little more complex. There are several different methods and different approaches you can take with them. And these vary, such as in whether or not we assume the effect of one component will simply add up on top of another, or whether they might interact in different ways. I've been conducting a simulation study to compare these methods across and how they perform across hundreds of simulated hypothetical data sets in order to put together a picture of how the methods we use impact the effectiveness estimates that we get out at the end. I'm going to try a 4th time to get it to go ahead. Where am I going? Oh, maybe. Yep. One result, for example, is a balance between accuracy and precision. More complex models might give us the most accurate results on average, but in doing so, they might tend to give results with very wide confidence intervals, or where there's a lot of uncertainty. And is that really the evidence that we want, or might simpler methods, simpler approaches be an advantage? So hopefully what these give us is a chance to improve our understanding of components. These might fill, having this knowledge might fill gaps in what we know and find clues that can point to the most effective combinations or that might optimize future interventions. And the aim is that specialist reviewers and statisticians can make the choices that will work best with the public health data sets, and hopefully we get the most value from these approaches. So thank you.
Hi everyone, I'm Lucy. I'm a transdisciplinary fellow at the University of Bristol, and I'm going to give you a whistle-stop tour of my ResNet project. So, climate change is one of the biggest threats to public health of the 21st century, and whilst we might be familiar with some of the physical health impacts of climate change, like novel emerging diseases, heat stress and air pollution, the impacts of climate change on mental health are still starting to emerge. But for example, we know that communities that are at risk of flooding have higher rates of depression and anxiety compared to those that aren't. And we know that suicide rates tend to rise during and after extreme heatwave events. So I'm really interested, if climate change impacts mental health, then do interventions that tackle climate change have benefits to mental health? So I'm really interested in exploring this in the UK. And not only do these interventions have co-benefits to mental health, but how do they affect different populations differently? Do they exacerbate existing health inequalities? Move on. So through my ResNet project over the last year, with many of you in the room as part of this, we started off by doing a policy analysis. So we looked at 27 local authorities across the UK with different characteristics. So large and small local authorities, rural and urban local authorities, and local authorities with different levels of deprivation. And we looked at their primary climate strategy and their primary health and wellbeing strategy to look at the extent to which health co-benefits of climate interventions are mentioned and measured. We found that a lot of local authorities are talking about the benefits of climate interventions for population health, but only one or two examples of where they're actually measuring them or setting targets around them. So we took these results to a stakeholder workshop, which we held in March. We had about 45 participants, about 30 local authority staff, including both climate teams and public health teams. And we dug into what some of the barriers and enablers to measuring mental health co-benefits of climate action are. And in parallel to this, we also did lived experience interviews with communities living in a livable neighbourhood in Bristol, so the East Bristol livable neighbourhood, traffic calming intervention, and residents of homes that have had retrofit measures done to them, and that included homeowners, private renters, and social housing tenants. And across all of those, we found that there's really strong demand by local authorities at the moment to measure the mental health co-benefits and health co-benefits more broadly of climate interventions. But local authorities want more support and better tools for doing so because they're not so sure where to start. There's a lot of real-world complexity. We found that there probably are a lot of health inequalities associated with some of these climate interventions, and the benefits aren't going to be equal for all, so there's more work to be done there to understand who wins and who loses, and how we can adapt to interventions to prevent those health inequality issues. And then in terms of next steps, we are hoping to, beyond the ResNet project, develop a framework to measure mental health co-benefits of climate interventions and test that across some larger scale interventions. I'm really keen to talk to people about this over the next couple of days, so please do come and find me if this is something that you're working on or interested in too. Thank you.
Okay, thank you. We've got some time for Q&A. I'm going to ask Sophie to come and get this to behave because it's not. I should have said this earlier on. For questions, there is a Slido there with the QR code. So you can post your questions up there. Thank you. Please post your questions up there, but we'll take some from the floor. I should have said that we had, in the three presentations, we had a launching fellow in Jack, PhD student in Thomas, and a transdisciplinary fellow with a ResNet award in Lucy. So they're all different parts of our capacity building programme. So any questions? Let's have a look. I don't have any, so let's have a look from the floor. Questions, please. You're honoured to ask the first question of ASM. Liddy, thank you.
Oh, thanks. Yes, it's Liddy Goddard from Sheffield. So, Jax, you said something, but I think it's probably something that all three of you could have said, which is that you couldn't have done this without SPHR. And obviously that's self-evident in terms of the funding, but I wonder if the school has given you anything else other than money?
It's always nice to have. Can you use one of the mics?
Oh, with my mic. I'm so not on it today. I'll be completely honest, it's not even the money. I'm a leveraged fellow, so I am supported by Judy Kidger, Rona Campbell, and the money came from within my university, and so I am part of this fellowship as a privilege. So it wasn't about the money, it was about the networks, it was about the wisdom, it was about the knowledge, it was about this, it was about talking to people over the last couple of years. I think 2 years ago when I presented that lightning talk, I can't remember how many people came up to me at the end. Someone from Cambridge, someone from Oxford, our university would be interested in collecting this kind of data. The training that we've had to make digital stories last year, I've gone on and used that to in other parts of my work. It's it's a community thing, it's feeling held, it's belonging, and it's having access to all of those tools and all of those networks is absolutely critical. I'm sure that's probably the same for you two as well. Does that answer your question? Yeah.
Yeah, exactly the same. And I don't think I could say it as well as that. But yes, a lot of the training is organised through SPHR or through the ResNet kind of early research career fellows, and that's been fantastic throughout my PhD.
Yeah, and I think for me as well, so I'm a transdisciplinary fellow, so I've moved from working in sort of environmental and social research into public health research. And I think 2 years of getting rid of imposter syndrome, or dying it down a bit, from feeling like a fraud working in public health to actually feeling like my skills are kind of valuable in this area, and building a network of public health researchers has been really powerful for me as well.
Great, thank you. I have a question here for Lucy, since you've got the mic there, Lucy. What was the process for collecting the policy data from local authorities like? I think we want a bit of reflection of how easy that was. I'm sure it was really easy.
Messy. Obviously this was done before the local elections that happened recently, so it may well change a lot, I suppose, over the next few months. Different local authorities are kind of looking into kind of climate change, climate adaptation in different depths. So I suppose while some of them have got a lot of they've thought a lot about, and in a very joined up manner, about environment and public health and how the two link together. Others are working still in very much silos, and in some local authorities with particular party leaderships, which I won't go into, the climate documents have been taken down entirely. So that was obviously problematic. But yeah, it was really, really interesting to look at the extent to which different departments within local authorities are kind of working in a joined up way or not. Yeah, sorry, that might not answer the question.
Thank you. And I think time for one quick question, and which for Jax this is, and Jax, this is not a counselling session, so somebody would ask.
Wellbeing.
That can be later. Somebody said, Jax, any top tips for applying for a welcome grant?
Gird your loins.
Great.
Stock up on smoothie and anything that keeps your energy here. Yes, have a fabulous team around you. Talk to Laura Tinner, who actually got a fellowship a couple of years ago. She's amazing. It's a long piece of work. It's a big piece of work. Gosh, I'm not. Well, get your ducks in line. Stay healthy. Look after yourself, and talk to Laura Tinner.
Yeah, there we go. Perfect. Okay, can we thank our speakers, please? Well done. And there'll be opportunity, because I know they're going to be around for the next couple of days. So please do talk. And Jax, you know, we've all been there. Everybody's been there, and it's about what can you gain from that. Pick yourself up. It's not personal, but it feels like it at the time. So well done for remaining positive and on your new job. Okay, so now I'm going to move on to a short presentation from my colleague Dr. Louise Hayes, who's going to talk to us about the Specialist Centre for Public Health. Many of you will know about this, but some of you may not. And I'm going to ask Louise to just come on up and present. I think for the slides, if you point it in this direction rather than the screen, it will actually move. Okay.
Thanks very much, Ashley. I was going to say I feel a little worried about not only moving the slides on, but also that I might have a mix of new brand and old brand from NIHR, so watch out for lightning bolt. So thanks very much for the opportunity to spend a few minutes just telling you about the Specialist Centre for Public Health. You may know that Ashley Adamson is also the director of the Specialist Centre, as well as the School for Public Health Research. Pleasure to be here, and I can give you the take-home message now, which is really, please do come and talk to us, because we're here to support you, whatever stage you're at, anything that you're doing around public health research that's outside the NHS, and that's our remit. So I'll tell you a little bit about what we are and who we are. So as I say, we support public health research that's been done outside of the NHS. And our sort of mission is to build capacity and capability to ensure that decisions that are made about public health in terms of the sort of those wider determinants of public health, so things that are happening out in local authorities and the decisions they're making, that they are informed by the best available evidence. And so in order to do that, we're mindful of the need, as is NIHR, and which they've demonstrated by their large investment, not only in us, but in the HDRCs, Health Determinant Research Collaborations, which I'm sure many of you know of, around building research capability and capacity. So we are supporting that goal by developing training and development resources, which we make available. We're also helping to establish or scoping out what's going on around research governance and ethics for people doing research out in local authorities and providing sort of templates and means of supporting that where we can. And in addition to that, we also provide some direct funding into local authorities to help to embed research within them. And alongside all that, excuse me, and the bit that I'm kind of mostly responsible for is providing a research design advice service. So we are part of the larger NIHR Research Support Service, which some of you may well know of. And so we also provide that research support service role as well. In terms of organisation, we're based up in Newcastle with Ashley as our director, as I say. We also have colleagues who are funded as the other part of the Specialist Centre for Public Health down in Southampton, so NIHR also funded a specialist centre down there. And then from our Newcastle base, we've established satellites around the country. So we have one, which is our Yorkshire satellite, based in Bradford, one in the Midlands, based in Birmingham, and Paymoney and Miranda, I think, as well, is here, who lead the centre in the Midlands. And our most recent satellite was established in the southwest in Exeter, led by GJ, who I've also seen over there. So we have, as I say, we've got a number of streams of work which we talk about in terms of these pillars. I'll whiz through them in the interest of time, but they are the direct support we provide to local authority, the research design advice service, which I'll say a bit more about, our training and development, the research governance and ethics, and our new-ish research delivery pilot, which I'll also say a little bit more about in a moment. So on three of those pillars, we're working very closely with our Southampton colleagues. So on the research design advice, training and development, and the research governance and ethics. And you can see across the bottom, as you would expect, all of our work is informed by our relationships with the public and our community partners. And we're very much promoting research inclusion and thinking about the impact that we're having as well. I'm going to say a bit more about these three pillars today, very quickly now. So I'll start with the research design advice service that we offer. So we're a team of methodologists, so we've got a broad range of expertise. Everybody in the team has direct experience of doing public health research, so they know what it's like. They know what it's like to get the rejections, and they know how personal it feels, particularly when it's a fellowship. And we'll provide support. You may know that the research support service, the sort of general research support service, only supports people applying for funding from peer-reviewed funders. But we'll talk to you at whatever stage you're at about your research and whatever sort of funding you're going for, or even if you're not going for funding at all. We're very happy to talk to anybody and give support and advice around designing research studies for non-NHS public health. So we will help you if you're preparing funding applications, so we can look for who might be the best funder and give tips. We know the most about the NIHR streams, and particularly the Public Health Research Programme, but we do also have some knowledge, which we're trying to build on, of Wellcome, ESRC and other funders as well. We're very happy to review applications once, twice or more times before you submit, if you've got drafts of applications which you want us to look at. We do a lot of work with people who are going for career development awards or fellowships, and so we can help you with those. So not only thinking about the design of your research, but all the other components of those awards. And I've listed some of the expertise we have on the slide, but just to flag, we have particular expertise around research inclusion and involving the public in your research, so please do come and talk to us about that, as well as all the other things that we can support you with. In terms of what to expect, if you come to us, we ask that you complete our request for support, and the link is on the slide there, and I think the slides will be made available afterwards. We've asked very basic information, just a bit of just to give us a sense of roughly what it is you're thinking of doing, what stage you're at, so we can then appoint someone appropriate to meet with you and have an initial meeting with a general advisor. And based on that meeting, we explore a bit with you what you want and how we can best help you, and then we'll arrange for you to meet with different methodologists and experts and specialists as required. And it's very much a kind of made to fit whatever your needs are. There's no kind of model as such, but generally it'll be an initial meeting, find out what you need and then direct you to support further with more specialist kind of support. And then as much support as you need. And sometimes we have a one-off meeting with people who have got very specific queries, and sometimes we'll have many meetings over many months and get applications submitted finally. And whatever works for you is what we can deliver. There's some stats about our research design advice service, which I won't go through now, but just to say it's increased enormously. We've been going for 2.5 years, I should have said at the start, so we've seen a big increase in the number of requests we're getting. And particularly we've seen an increase in requests coming from local authorities, which is great because we're really keen to support that. But we are also equally keen to support our colleagues in universities as well, so we're not only supporting local authorities, just to be clear. In terms of training and development, we've our training lead, Nicola Sheen, has done a huge amount of work scoping out what the needs are for training around doing research outside the NHS in public health, and she's developed these very basic explainers that you can click on and have a look at if you're interested. You probably all know all of this already, but this is really about communicating to local authority staff who maybe don't see the value of research and trying to help them to understand and get on board with the need for it. There's also a whole load of information and training that we've developed ourselves or that that Nicola has kind of looked at and thinks is useful and of good quality, which is all on our intranet, and you can see I've put the link to it on this slide. But that includes things like learning stories, so examples of practice where people have made research work well in these non-NHS settings and so on, as well as a lot of information around PCP, so our public involvement, public and community partnerships. So that's all on our website, and I'm going to finish just by saying very quickly for a minute or two about our fairly new pilot of a delivery service for non-NHS public health research. So this started back in September now, so not all as new as we sort of might hope, but this was kind of a pilot study or pilot service that GHSC has funded to look at what support people doing non-NHS research need that would be provided by the CRN or RDN, as it is now, Research Delivery Network, if you were doing clinical research. So that's been led by a colleague of mine, Laura Rennick, who used to work for the CRN, so she's got real expertise in what CRN used to do, and bringing that now to try and develop a pilot service, which we will then run for a number of months and evaluate and make recommendations about what's needed in terms of support that people require to conduct their non-NHS public health research successfully. And you may well have already been approached to be involved in that. Laura has been doing a lot of work scoping out what the needs are and is currently running workshops to sort of design the model for what that might look like before we go on to pilot it. So if you haven't been involved yet and you get approached, please do get involved. It would be really, really, really valuable to get your experiences of what would help you to deliver your research. And I think that's all I'm going to say for now, and very happy to take any questions if you have them, or please do come and chat during the conference.
Thank you, Louise. We've got, I think we can both just be here. We've got one comment and one question. Okay, so I'm going to ask the question first. So, can the RSS Specialist Centre Public Health support public health research that straddles both local authorities and the NHS?
Well, we can. We're quite, what's the word, generous in our interpretation. So I think if there's anything that's happening within local authorities, we would be looking to support. As me individually, I work across I'm mainly for the Specialist Centre for Public Health, but I also have a role in the Newcastle hub of the Research Support Service. So if it was something that was straddling NHS and public health in local authorities, we could certainly support via that mechanism. So yes, come and talk to us.
Okay, great, thank you. And then this is not a question, and I will ask if there's any questions before we close. Not a question, but I've only heard amazing things about the research design component, and I've been fortunate enough to receive support myself.
Oh, how lovely.
So that's a very nice bit of feedback, so
Make
thank
sure you
you.
keep that.
I'll hold on to that, yeah, we've captured that. Is there anybody with a burning question on the floor that hasn't been able to get onto Slido?
I have got, sorry.
Oh, Peter.
And we have got a stand, so do come and chat over the breaks if you...
If there's anything that Louise has mentioned about the LARPs, the fells, anything else, please do go and talk to Louise in the breaks and the stands. Peter, brief question and...
Brief question. Thanks, Louise. Can I just ask about the early funding for PPI? I mean, certainly when at the commissioning stage, we talked about how important it was that...
That's a great point, Peter. Thank you.
And the peer application, yeah?
Yeah. So we do indeed have funding for people applying for research funding that want to do some early public involvement where you maybe haven't got a pot of money available to reimburse your participants. We have funding available for that up to £700, so to reimburse the costs of people doing that. So do come and speak to us about that as well. Thank you.
Great.
Yeah.
Thanks for that, Peter. Good reminder. So that fund is there. Okay, so can we thank Louise, please? Thanks. Okay, so thank you. I'm now going to hand over to Judy Kidger, who is going to introduce our next keynote speaker. Thank you, Judy.
Great, thank you. Morning, everyone. So I'm delighted to introduce our next speaker, Efua Poku-Amanfo, who's the head of the Children and Young People's Mental Health Coalition. Efua has a wealth of experience across health, education and public policy, and a lot of her work actually connects to all 4 of our research programmes within the School of Public Health Research. Before she took her current role, Efua worked at the Institute for Public Policy Research, and when she was there she led the public health work, and one of the things that resulted in was a successful report called the Healthy Places, Prosperous Lives report, which was published in 2023. After that, she went on to lead the Institute's work on children and young people, and that included working across school exclusions, youth unemployment, and special educational needs and disabilities provision, so things that are still really hot topics currently. So very pleased to welcome you, Efua, and over to you. Thank you very much. I think it should just come up, yeah. Or maybe I don't know if you have to press it to go on whichever one's been fiddling. There we go, yeah.
Okay. Great. Hi everyone, I'm just getting my laptop's died, that's fine. I've got notes somewhere else. Hi everyone, really great to be here. I'm Efua Poku-Amanfo. I'm head of the Children and Young People's Mental Health Coalition, and just here to really just tell you about the work that we do and how you can work with us if you're interested. And I'll just be talking for maybe around the next 20 minutes or so, and hopefully we'll have some time for questions at the end. Is this next? Okay, there we go. I'm gonna move it. I have to really press it, okay. Okay, so who are we? So we are a collaborative network of over 440 organisations who campaign jointly on babies, children and young people's mental health and wellbeing. We're hosted by the Centre for Mental Health, and we were set up in 2010, and we are chaired by Amy Whitlock Gibbs. So we listen to and learn from members and supporters, children and young people and families, and we use this knowledge to influence and shape policy systems and practice. And we try to do this by making sure that we're really aware of the different pieces of work that might be happening across government, staying engaged and involved with campaigns and working closely with the sector just as a platform to kind of elevate their expertise. So for example, many of our members are frontline workers, so their insights on a day-to-day can really help sort of shape the direction of our work, and we can just feed that back to civil servants and other government sort of officials that we meet. So how do we function? So we are member-led, and that means that we consult our members through a number of different ways to kind of collaborate and share expertise and evidence. We can often disagree about policy, but given that we are brought together through our kind of shared passion for improving children and young people's lives, we're often able to kind of find a middle ground. We also work directly with young people. Many of our members have kind of youth boards or youth advisory boards, and so we may work with them to kind of gather more insights on lived experience or sort of test ideas and policies. And that might be through kind of designing workshops or sort of doing some polling or just simply just kind of speaking to and learning from them and their lives. And we are really actively involved in a number of different campaigns. So we tend to collaborate with other organisations, and being a coalition really allows for our campaigns to go kind of far and wide. And then finally, we have a steering group, which is really a kind of integral accountability mechanism within a coalition as big as ours. So we hold kind of quarterly meetings with the steering group, and we share our updates on our work and get a steer on kind of what priorities should be for the sort of next quarter. So we tend to kind of work across evidence, policy and practice. So when it comes to evidence, the Centre for Mental Health, which hosts the coalition, often provides sort of new insights or new findings on children and young people's mental health. Occasionally the coalition is commissioned to do new research, and we would usually do this as part of a campaign or more of a specific project with a kind of clear sort of hypothesis from the start on what we want to explore. And then also we often pull on secondary sources as well, so from academia and think tanks, and our work is very fast paced. So if we don't have the time to do research, or the research we have is a bit dated, then we will utilise kind of what researchers have found from other places. Our main goal on kind of policy is just, essentially to kind of influence government and make change. So all of our policies tend to kind of consider the sort of current political landscape, and that means sometimes we will call for maybe an extension of a policy, or we might, if we think that policy works, or we might, call for the removal of a policy, or just simply introduce a kind of entirely new idea as well. And then just on practice, we will gather intel from practitioners, which can help shape our policy development, and the intel we receive also from practitioners kind of helps us assess whether the policies that government are actually implementing underway are actually working in reality, or being implemented in the way that governments say that it's supposed to be happening. So these are just our steering group members. As I mentioned earlier, we meet quarterly, and we have CEO representation from across these organisations that attend our meetings. They're a real mix of people and organisations, so people coming from the wider kind of mental health sector, those with maybe more specific focus in their work, some from public services, and some that are just kind of more general on children and young people's work. And then this is our kind of 3-year strategy, and you'll see that we're heading towards the end of our strategy by the end of this year. So this is a really exciting time for us to kind of refresh that. And our strategy kind of has 3 main focuses. So firstly, that we want to achieve a mentally healthy generation with a focus on reducing kind of risk factors for poor mental health, and ensuring all babies, children and young people have strong protective factors. Secondly, early intervention is key, so the focus on ensuring that there's always a choice of early intervention services in a range of different settings, and that groups of babies, children, young people at risk of poor mental health are prioritised in accessing early help. And then finally, we want to really strengthen specialist services to deliver the kind of very best mental health care for babies, children and young people. So our work is, and our strategy is largely kind of shaped by the mental health landscape, which says that the majority of adult mental health problems first emerge in childhood and adolescence, and with half of all lifetime mental health problems established by the age of 14 and 75% by the age of 24. 1 in 5 children and young people have a mental health problem, and that's increased since 1 in 9 since 2017. And suicide is the most common death for boys and girls aged between 5 and 19. For the NHS, I guess, referrals for NHS mental health services and children and young people have tripled from 40,000 in 2016 to almost 120,000 in 2024. And 75% of young people experiencing a mental health problem are forced to wait so long that their condition often gets worse or they're unable to access any treatment at all. And a few years ago in 2023-24, there were around 5 million attendances to A&E for young people, of which 64,000 had a primary diagnosis of a mental health condition. So whilst there is a lot of research that has helped us learn, that children and young people's mental health is clearly in a crisis and has been for some time, there's a lot that we, don't know. There's been a lot of discussions in the kind of political space on overdiagnosis, but there's no real evidence really to necessarily say that there is a problem with diagnosis and overdiagnosis. There is still limited population data on the conditions like ADHD and autism, which is hopefully currently developing, but we're not there yet. The language in mental health is still kind of skewed. So there's still a lot of stigma. So for example, mental ill health is sometimes missed in data sets because it can fall into other categories. So school exclusions is a good example of that. Poor behaviour is what you might see in a Department for Education data set. But that poor behaviour, we don't actually know why and what's driving that, and if that's because of a mental health condition or a neurodivergent condition as well. Early interventions aren't all kind of well evidenced as well. So while many of our interventions that we do know about are some of them are quite well evidenced, there is still a lack of information why some might work and why some might fail, and why which intervention might be better suited for those with complex needs. And then just finally on methodology, research approaches can be limited in capturing kind of a really true picture of things like lived experience and the clinical and social economic factors that shape children and young people's mental health. And so even though research is a great way of understanding what's going on, it can't always tell us the full picture, especially when we, the coalition, don't always have the capacity to do things like longitudinal studies that can give more insights over a longer period of time. So when it comes to policy, we're currently, it feels like, I guess for us, that we're operating in quite unprecedented times for children and young people's mental health. So, the government has committed to raising the healthiest generation of children ever. They've made several commitments in their manifesto in 2023 to improving mental health support. So, including things like a mental health specialist in schools, expanding mental health support teams in schools, rolling out Young Futures hubs, which is supposed to provide things like open access, drop-in mental health support. They've also reformed the Mental Health Act, and just generally kind of increasing the mental health workforce. When this government came into power, they also developed a 10-year health plan, which you may be familiar with, and they made this plan in collaboration with the general public. So they really did lots of sessions to kind of understand what people wanted to see in that plan. That was published last year, and that included 3 sort of overarching shifts for the NHS and wider services. So moving from sickness to prevention, so treating illness rather than just preventing it rather than just solely treating illness. Moving from hospital to community, so delivering care in local communities rather than solely in clinical spaces like hospitals, and then from analog to digital, so embracing new digital technologies. And this plan, I think, it really emphasises the value in moving care into the community. It seeks to transform mental health services in a kind of 24/7 neighbourhood care models. It enforces the commitments that I mentioned earlier, like Young Futures hubs and mental health support teams. It aims to kind of address things like, the lack of access with specialist children and young people's mental health services. The government have also put a lot of resources behind that, 120 million to establish mental health emergency departments. And there's now an ongoing kind of work that's happening in the Department for Health and Social Care on developing a kind of new modern service framework for children and young people's mental health. And that's still being iterated and developed, but hopefully that will be something that practitioners can use. So I think we find ourselves in like a really interesting context politically. Like arguably there hasn't been a time where there has been so much movement in government to bring around sort of better outcomes for children and young people's mental health, yet we know that funding continues to be a really big challenge, particularly in the context of integrated care boards and their spending reductions, and that means that the reform that we see might not come with new money. So, you know, there's always trying to find new ways to be more efficient in delivering better outcomes, not necessarily putting more resource behind it. There's also this worrying kind of over-diagnosis narrative, which kind of risks obscuring some of the reality that a lot of young people are actually facing. And then there's also just a kind of need for more and more evidence to not just demonstrate the need, but also to demonstrate the value of delivering interventions and the cost effectiveness. So we are increasingly having to kind of make stronger economic arguments to the Treasury, given the fiscal context that we're in. So the next part of the presentation, I'll just talk you through some of the live kind of projects and campaigns that we're working on to try and capitalise on the opportunities that that we have right now to try and influence. So firstly, we have Fund the Hubs. And since 2020, the Fund the Hubs campaign has really been calling for a kind of national network of early support hubs across the country. And that would provide kind of early support for young people's mental health when their problems first start to emerge. In 2023, the Department of Health and Social Care committed around 5 million for around 10 hubs to expand their offer of support for children and young people, accompanied by like an evaluation to kind of sort of assess value for money, essentially. And in February 2024, additional funding was also given, and we've also since seen, so earlier this year, we've seen additional funding sort of announced for early support hubs, but it's been a very gradual thing when it comes to the funding, kind of here and there, given us additional money as these hubs have been sort of underway. Social media has been a really big area for us, in particular this year, as the government are currently consulting on doing the consulting on the social media ban for under 16s and exploring whether this is the right approach or whether there are alternative routes to making the online world safer for children. Quite inspired by the ban that happened earlier this year in Australia. I think there's been now new conversations around whether that would be something that we could do here. But I think for the coalition, we consulted our members and we looked at the research, whilst there's limited research, but we looked at what there was there, and we quite confidently feel that a ban wouldn't be the right approach, and that's because the evidence on whether social media directly impacts mental health, especially when it comes to young people, is quite sketchy. We do know that poorer children, for example, have higher screen time use due to the lack of access to like extracurricular activities, and we do also know that online harms, you know, when they're experienced far more harshly for minoritized children or children who already have pre-existing conditions. But there isn't evidence to necessarily point the finger at social media as a causation for mental health conditions in young people entirely. So we're just sort of continuing to engage with the government and calling on for more regulation of things like addictive and persuasive features, to have more regulation around those things. We don't want under 16s to not be able to benefit from what we think are some of the positive things that social media can offer, but we want like an extension of like the Online Safety Act, for example, to keep all children and young people safe. Another key area for us is there's an open consultation on special educational needs. There were new announcements outlined earlier this year in the Children's Wellbeing in Schools Bill. And that moved from, it was quite a big reform because it moved from a single sort of tiered system to a multi-tiered system. So what was initially, you had to reach quite a high threshold of need in order to get an education, health and care plan. Now there's like a multi-tiered system. So there's like universal for all children and young people, targeted plus, and then of course that specialist threshold that still exists. And by doing this shift, it was a really welcome shift for us. A lot of young people may not need a diagnosis or a note from a specialist to kind of get some kind of provision and support in their school day-to-day lives, which we think is a positive, and will be sort of continuing to engage around this. But there have been a lot of changes that we are unclear on what the implications will be for them. So, for example, there is something called a kind of SEND Code of Practice, which is a document that outlines the sort of legal requirements for those supporting children with special educational needs and disabilities. And the recent reforms kind of removed social and emotional mental health, what we knew that term to be, and that was a data set that could capture young people and children that had social and emotional mental health needs, and they moved that and changed that to social and emotional needs. So they took out the mental health. So we're not clear why or what that means, and what that means for a young person with a mental health challenge that might not have a special educational need. Are they still eligible for the highest threshold of the provision that's available for them? So that's the kind of stuff that we're trying to lobby on, essentially. There's also a review happening on the prevalence of conditions like ADHD and autism. And as I mentioned earlier, there isn't necessarily enough population level data on these conditions for all ages, but particularly among young people. So there's a review that's aiming to explore why there's a rise in these conditions and what we should do about it, essentially. There was an interim review that was published earlier this year in March, which outlined that mental ill health is now a challenge experienced far more acutely by children and young people. So, and that's just comparing to all ages. And that's very different to previous decades where mental health challenges were much more commonly associated in midlife. Clinical solutions and diagnosis, it was a real kind of recognition that they can't be the only legitimate routes to accessing support. And the next phase of the review will really look at the kind of policies for change, and we hope to engage with that as well. Doesn't want to go to the next slide. Okay. So one of our flagship campaigns is the Future Minds campaign, and it's a really ambitious campaign made up of the Centre for Mental Health, the Centre for Young Lives, and of course the Coalition and an organisation called Young Minds, and we're supported by the Prudence Trust. And we joined forces to call for urgent government action to address the sort of rising levels of mental ill health among children and young people. The campaign launched last year, with the intention to set out the economic and social case for investing in children and young people's mental health. And our shared aim is to drive this issue higher up the government agenda and secure sustained long-term investment. Our first report, for example, found that mental health problems in childhood cost the UK over £1 trillion in lost lifetime earnings, underlining really that scale and urgency of action that's needed. And we created this campaign for really three key reasons. Rising needs, as we know, mental health problems among young people have increased sharply in recent years. The system being under strain as a result, incredibly overwhelmed system with long waiting lists and then just high thresholds for getting that support. And the economic impact, which was really important that we included that in the campaign, because poor youth mental health is holding back, of course it's holding back young people, but it's holding back growth and skills and productivity. And we know this really speaks to the government's growth agenda. So we thought it was really important to build that in to the campaign. And the recommendations from our report kind of speak across 4 key areas. I won't go into detail on this, but really it's kind of expanding community-based early interventions, so investing in high-quality early years provision. Secondly, stabilising specialist mental health care. Thirdly, transforming crisis care for young people. And then finally, just harnessing digital innovation responsibly. So, prioritising kind of need-led, regulated and evidence-based digital tools. So this is the the kind of graphic, I guess, like the Future Mind neighbourhood health graphic, which visualises what we want to see if all our policies were adopted. So kind of like it's somewhat of a utopia, but I guess it's kind of just meeting people's basic needs. So it's not really utopian, but yeah. So yeah, well, it depends how you want to frame it. But you'll see that we designed this sort of neighbourhood on the foundations of good health, which we know are really well evidenced in public health. And then this kind of creates sort of multiple avenues for support for mental health needs. So they exist both in and beyond the health system. And I think it's really important to point out here as well is that we really see the voluntary sector and community groups as integral to improving individual and community health, and not just thinking about health as a kind of individual thing, but also a collective thing. And that's shaped by where you live, who you interact with, and the organisations and how strong they are within your community. And so this neighbourhood is really a combination, of kind of community-based early interventions, specialist care, and then just trying to harness digital tools so we can efficiently sort of signpost people to the right places so it doesn't have more of a strain on the system, but also just doesn't waste patients and people's time, and they don't have to keep on being around multiple different specialists and having to re-explain their needs, but actually can go to the right place at the right time without that experience being too sort of long-winded for them. So I'm just going to wrap up, but I thought it would be good to just outline sort of the change that we kind of want to see. It's ambitious, but we really want to see the eradication of mental health inequalities for children and young people. And that includes sort of getting to the social determinants of health, so an end to child poverty, an end to racial injustice and all forms of discrimination and prejudice, an end to punitive responses to mental ill health. So that's within, I guess, what's relevant for the coalition is within schools, but for the for wider society, that's also includes the criminal justice system, and we want more compassionate and rehabilitative kind of care instead. And we really want the government as well to kind of see this as urgent and important as us. And so that means putting mental health as equal to physical health, and implement a government-wide strategy on mental health. And we really want that to be partly youth-led. So if you look at departments like the Department for Culture, Media and Sport, they have youth boards in that department. We want to see that across all the different departments. And we want to widen access and opportunities to support families and parents and carers, and just recognise that strong communities create safe and healthy and resilient children and young people. So we'll continue in our work to kind of engage with government across the areas that I mentioned before. There's also some other areas I thought would just be useful to quickly mention here, which is that there is a Health and Social Care and Education Committee inquiry, and they're leading an inquiry into children and young people's mental health. There tends to be a kind of open call for evidence, and now they're doing their hearings on that. The Department for Health and Social Care are developing that modern service framework that I mentioned earlier, and the coalition have been sitting on that board, and we hope to continue developing that with them. And then just ongoing kind of regular meetings with civil servants and senior advisors, and being part of working groups across government on youth hubs and other areas, and just trying to be as engaged as possible. So I hope this presentation was useful and interesting for you. There are two ways that you can stay in touch or be part of a coalition if you're interested. Our members host monthly kind of lunch and learns where they share their research and their practice and often feed into those consultations like the SEND consultation or the social media consultation. And we just tend to collaborate in any way that we can that doesn't have to solely be with members. So that's across the wider kind of third sector and public services on a more ad hoc basis as well. So yeah, thank you very much for listening to the presentation. I put my details there if you'd like to learn more about our work or get involved. Yes, you can find us on social media. Shall I go? Yeah.
That's great. Thank you so much, Efua. I think there's loads in there that's lots of interest to lots of us in the room. I have got a few questions on here, so I might start with one of these while people are thinking. Sorry, microphone yet. Yes, and obviously. We'll make sure the questions are kind. I'm sure there will be. So there's a couple of comments here, but the question is, For people that are primarily focused on prevention, which most people in the room would be, as well as early intervention, or not just early intervention, what new research and policy should we be advocating for to support young people's mental health?
Okay, let me have would you be able to give me a few questions and I think about, so that first one's about prevention and what should we be focusing on?
Yeah, I guess what are the key research and policy foci at the moment? I mean, actually, that's the only question I have. I can tell you.
No, that's fine. I mean, thoughts are coming to my head. I'm just writing it down so I can gather my...
Yeah, it's a big question, that one.
I would personally love to see a lot of like research in like community-based interventions, particularly around like Young Futures hubs or any kind of hub. I think that's because on the political side, I don't think that the government entirely bought into that being something that they should like put all their funding into. There are some evaluations that are underway, and of course, as I mentioned earlier, hubs are happening, so they are bought in it to an extent. But I think when it comes to more community-based stuff, it's harder to evidence it. You have to do it over a longer period of time to see kind of like the outcomes. It's quite expensive, but also it does feel like sometimes people use phrases around policy being quite fluffy, and I think hubs feels like a kind of fluffy policy. It's like a kind of nice thing. We can just have hubs and have playtime, and it's not that. It's actually there've been hubs around in the UK for over 60 years. So that would be something I'll keep thinking. But yeah, that's the first thing that comes to my brain. Yeah.
That's brilliant, thank you. Great, so we've got lots of questions. Do we have a mic? Yes. If we take the person with the red top, sorry. Yeah. And then...
Hi, thank you very much, really interesting. Helen Hoyle from University of Sheffield. I'm a transdisciplinary fellow with a background in landscape architecture and nature-based solutions. I was really interested in your visual of the future neighbourhood. And I noticed there was a very big green swathe across the bottom and there were a few trees around. Yeah. Would you agree that access to green, blue spaces is a sort of key component of that safe and healthy neighbourhood? Because, there's a huge amount of research evidence for the benefits of nature contact for physical and mental health. I'm just interested in your 100%, thoughts on that.
Yeah, I mean, I haven't done any research in my current role on that, but in my previous role on kind of leading research on public health on the Commission, that came up really, really, really strongly. And we did that in places like in Scotland, on coastal towns, and like the blue spaces were just as valuable as green spaces. And I think also just going back to kind of community-based interventions, like hubs can actually kind of work with organisations that have expertise in working in nature. And I think for a lot of young people that live in urban spaces that don't have the opportunity to necessarily get out there, I think a lot of them will also express the kind of the need for that and the benefits for their mental health and well-being more generally. So, yeah.
Great, thank you. Should we take Matt, just while you're there?
Hi, Matt Egan, London School of Hygiene and Tropical Medicine, and it was a great presentation, thank you. I guess a lot of what you presented talked about was mental health support services and hubs of different kinds in the mental health workforce and community base. And then in your diagram, you have the foundational kind of level with things like financial and housing security, and then later on you talked about child poverty. I was really wondering, how easy is it for you to both think and act at that foundational level as an organisation yourselves, and how easy is it for you to persuade government or anybody else to think or act at that level? Or is there sort of a gravity that's more to the really important work that goes on more at a kind of community level above the ground?
Yeah, it's definitely not easy at all. I think that we have like a set of values that drive our work, and a lot of that is like the foundations of good health. But sometimes I think we have to be a bit more strategic about how we might influence government, and that isn't necessarily being really radical and saying, actually, what you need to do is give everyone socialised housing. Like that might be something that we would want to say, but we would we wouldn't say it because we know that we wouldn't be able to have strong relationships with government because they would think it wasn't a tangible thing that they could actually implement. So I think it's more about the foundations of good health and what our values drive the policies that we make. But when it comes to actually asking for things, they're a bit more incremental or based off of what we think is feasible for government to actually implement. But there are things that the government have done, like things like removal of the 2-child limit, and that was something that was really evidence as something that can lift like hundreds of thousands of children out of child poverty. So those are things that we still call on bigger things like that and really welcome them. But we have to do a little bit of the incremental stuff as well as the radical stuff. It's a combination, I think.
Thank you.
Yeah.
Great, thank you. I'll take one question from here then. There's some more in the room as well. So there's a question here. Given the stark inequalities in mental health outcomes faced by LGBTQ plus young people, are these inequalities a focus of any of the organisation's work?
The organisations that are in the coalition?
Yeah, or the coalition itself, I guess, as well.
Yeah, definitely. I mean, it's definitely, we definitely have organisations that focus on things like LGBT homelessness and that being something that, is a focus for their organisations. It isn't, I think we would tend to say that we use language like social justice or we want to eradicate like discrimination and any forms of prejudice. So, but we rarely kind of do work that speaks to a specific kind of demographic in that way, I would say. I think we try to be a combination of kind of universal policies and then occasionally targeted policies. But I think we would hope to feel like anything that we do say would help the young people who are at the highest end of like being minoritized or marginalized, I think. So yeah.
Great, thank you. Okay, still lots of questions. I've lost where the mic is. But, sorry, thank you. Should we take? Sorry, I'm picking all the ones at the front. Steve, yeah. Oh, just here, yeah.
Hi, I'm Steve Strong. I'm a public contributor. Most of my working career has been with adults, I'm interested to know whether you've come up with any advice, good practice, good research about managing one of the greatest risk areas in my experience, which is the transition between children and young person services and adult services. You often see good stuff collapse at that point. I'm just wondering what your organisation is saying about that risk area.
Yeah, I wouldn't think of any specific research off the top of my head in that, but we do often talk about the fact that a lot of young people who are on like CAMS waiting lists, for example, by the time they're actually seen they're an adult, and what that actually looks like, and actually calling for kind of specialist care to go up to age 25, for example. We also think about transitions into adulthood outside of the health system, so we think about like the school to work transition and the fact that there's a lot of young people that are like not in employment, education and training, and that it has a big impact on their mental health and well-being. So we want a lot of the things that government are offering children and young people to actually go up to age 25, and there to be things like work, like supported like workers that they can have that will be part of them through that transition, so that they don't fall off at 18 or age 21.
Yeah, great, thank you. Okay, working back, there's Rowan. So yeah, just up to the left.
Thanks so much, Efua, for your talk. I'm Rowan, I'm from the University of Exeter. You were just talking about some of the kind of campaigns that the coalition's been working on. And I was really interested to know a bit more about the work you've done in translating research into policy. And I'd be really interested to know if there were, through your work, if you've noticed any particular sticky points and when trying to put research into policy or trying to communicate it to people involved in creating policy, and anything that you've observed that can mitigate that.
One of the thoughts that's just come to my mind is that, not to be pessimistic, but I actually don't always feel that like evidence itself is what kind of is the thing that makes government do things. So that can be really frustrating, that you can, even if it's pulling on secondary sources from people like you, or if it's research that we've done ourselves, that knowing that actually when it comes to that translating into policy, it might not be directly linked to the evidence itself, because we know that when we get to the policy, there's like lots of other things that are going on in government, like what's being ideologically driven, that is really the reason why they may or may not do something. And what can be frustrating, I think, is when we do develop a lot of evidence-based policy, and then sometimes are told that we need more evidence. It's not enough evidence, and then we then see a new announcement on something that actually we're like, this isn't evidence. So it's just a bit clunky, the whole thing, to be honest with you. But I still think it's still meaningful work and important to build on evidence, and to make a strong point about it. But just knowing that, like, how a policy might be adopted might not be how you wanted it to look, or it might not be necessarily linked to the evidence anyway. Sorry.
Yeah, no. Thank you. And while we're on tricky policy and government questions, there's one here. Despite the developments made so far with this government, which you talked about, is there a fear that progress could go backwards with a future potential government change in the main party? Yeah, short answer, yeah.
Yeah, I think so. Yeah, I mean, there's someone that I work with really closely, Greg. I wish he was here because he does a lot of the political engagement across the political spectrum, and now obviously our spectrum's even bigger now. And I know that we will be presenting to, like, the local government association. They have a committee on children and young people's mental health, and they have lots of councillors. And obviously now there's been the local election, so a lot of their councillors will be, from the Greens to Reform, and we do know that there will be some people that just from a position of, like, things like, people use the terms like snowflake generation, or just thinking this is, or overdiagnosis. We know that there will be people that will just show up to just give us a hard time, basically. But I think we're like perfectly happy to engage, and we think we have to engage given that they've got a lot of leverage. And yeah, there is some fear there, but I think that this work's been happening and been led by academics for such a long time that there's just way too. If it's a conversation of evidence and whether we can prove it, like, we definitely can prove it. This is a crisis. So
yeah, great, thank you. And we'll, okay, yeah, just along there, thanks.
Thank you very much. So, in your Future Garden community, there was something in the foundation about recognizing people's agency and also self-confidence. There's a lot of healthcare by its very nature. We want to intervene. We want to provide support. I think that provides a lot of helplessness in people. We don't recognize the resilience and the agency of young people in taking ownership of their own mental health. Mm-hmm. And what interventions we need to provide, what sort of facility we need to provide so that they can recognize their own self-agency, and rather than wait for someone else to come and intervene and provide support, provide diagnoses and so on.
Yeah. Yeah, 100%. I think agency and autonomy and the young people's voices are really integral. I would say, just having worked with young people, I think they know that they have agency and autonomy, and they actually are speaking up often. And what happens is disillusionment happens over time when they meet with specialists who kind of are quite paternalistic towards them and undermine them. And then eventually, once they get to kind of a stage where their needs become more, like, really acute, they don't want to engage with their system at all. So I think that a key part is when young people are presenting early needs, and often I think a lot of them might show that they need support in verbal ways and some non-verbal ways, but I think it's for us to kind of be attentive to what they are. But I think a lot of them do have quite a strong voice, and it's just that we've kind of shut them out. And so I think we have to kind of, figure out how we can stop that from happening so that they don't get disillusioned, essentially. Yeah.
Yeah, great, thank you. We've still got a little bit of time, so there's a question here, if you're able to get down there.
Kind of connects to the last one. So previous piece of work I was looking into, my name's Lee from Teesside Fuse project, looking into an idea of intergenerational justice and democracy. And you can define this just future generations, but also young people today. And organisations like Fridays for the Future were quite explicit on this, saying we are the future, 50% now, 100% in the future. Are the young people you've come across making similar arguments about having more of a say about their future that is being denied to them at the moment?
are young people are they asking? So are they wanting more of a say over their future and feeling like they're being shut down?
Political decisions on climate, on kind of infrastructure, on
Yeah.
mental health.
Yeah, I mean, there are lots of like or countries around the world that have like co-production embedded in the way that they make policy, especially around children, young people. And the UK is actually pretty far behind on that stuff. We occasionally have like so for example, there was a national youth strategy that came out last year, and they did lots of polling and interviews with young people, and that was quite unprecedented for a British government to do, but actually still was quite nowhere near in comparison to what countries like the Republic of Ireland do, and lots of other countries. So I think, a lot of young people are still asking for to be part of co-production, where they're involved from the beginning, middle and end, and any times that policy is iterated, that they're consulted on it, and that they can be part of policy testing. I think a lot of young people want that, but I think there's still a lot of reluctance, because I just think the UK are quite behind with that. So yeah.
Great, thank you. I think we've got time for, if anyone's got a quick, there's two people at the back, I'll let you fight over the microphone. Probably only got time for one more, depending on how quick it is. Just one.
Good afternoon, I'm Paul from Gillingham. I created Gillingham Town Football Club in 2010 to support men with mental health issues. So 10 years ago, I came out of a rehab, and Gillingham Town helped me stay sober for the last 10 years. So we have now got a youth set up. So I was just wondering, how come you've not thought about going into grassroots football clubs or any other sports clubs with children?
Going into them, what do you mean?
Making a partnership, and because we've got 115 children from the ages of 6 to 11.
Yeah, I mean, it's definitely, we're always open to partnership. I mean, we have a lot of grassroots organisations who are members of the coalition, so we'd always be open to working with more and more organisations, like Football Beyond Borders, who do really great work with young people, are a member. So, Yeah,
great.
We would be up for it.
Yeah, so we can share details again about how to get in touch for clubs like yours. That's great, thank you. Excellent. Well,